Welcome to the orientation for Las Palmas Kidney Transplant Center. We thank you for choosing Las Palmas for your kidney transplant evaluation. The focus of today's presentation is to provide you with information about the transplant process at our center. Our center is an adult-only program designed to meet the unique language and cultural requirements of our community. We understand that you may feel nervous or overwhelmed with starting this process. Our friendly staff will help guide you through the process and address any concerns you may have. Welcome.
Kidney transplant is the preferred treatment for kidney failure. It is important to keep in mind that getting a transplant is not a cure. It is a treatment. If you have diabetes and/or high blood pressure, you will still have these conditions after transplant. Having a kidney transplant gets you off of dialysis. You will no longer have fluid restrictions or strict dietary restrictions. Our dietitian will provide more information about your diet. Having a kidney transplant improves your quality of life and survival compared to remaining on dialysis. However, there are some risks associated with kidney transplant surgery and the medications you take after transplant. Some of these risks include delayed graft function, infection, rejection, delayed wound healing, and cardiac and respiratory complications. The evaluation you will undergo will determine if kidney transplant is the best option for you. Patients must meet initial criteria in order to be considered for our program. Reasons why you would not be a candidate for transplant includes the following, but is not limited to having active cancer, an active infection, advanced heart disease, severe disease of the blood vessels, active liver disease that would require a liver transplant, HIV or AIDS, advanced lung disease, severe obesity. For our program, you must not have a BMI greater than 37, lower urinary tract anomalies preventing urine drainage by normal means, active use of drugs and nicotine, and any unstable psychiatric conditions. Also, having documented noncompliance and adherence to medications, dialysis treatments, and fluid restrictions may affect your candidacy.
The transplant evaluation process includes several steps. After completing the orientation, you will be scheduled to see the transplant surgeon. If the surgeon approves you to start your evaluation, you will then be scheduled to see the financial coordinator and the social worker. The financial coordinator will verify insurance coverage for all patients and will inform you of benefits, copays, and out-of-pocket costs. Patients with traditional Medicare and Medicare Advantage plans will fall under our program's plan and will not have copays. Patients with private or commercial insurance will be responsible for copays and out-of-pocket costs. Once completed, you will be scheduled to start your testing, which may include blood work, imaging studies such as chest X-ray, abdominal ultrasound, and CAT scan, along with cardiac tests that includes an EKG and echocardiogram. You will be scheduled to see a cardiologist who will do more tests on your heart. If you are 45 years and older, you will require a colonoscopy. Each evaluation is individualized, so testing may be altered as needed. It is important that you arrive on time to all your appointments. You will also be evaluated by our dietitian, pharmacist, and nephrologist. Once you have completed your evaluation, your transplant coordinator will present your case to our selection committee. The committee will determine if you are a candidate for transplant, if you need further testing, or if you're not a candidate for transplant. Your transplant coordinator will notify you of the committee's decision and our recommendation. A letter will also be sent to your dialysis center notifying them of the committee's decision. If you are not on dialysis, a letter will be sent to your nephrologist. You're not listed with our program until you're notified by your transplant coordinator. It is important to note that if you are transplanted at a center that is not Medicare approved at the time of your transplant and you have Medicare, you will not have drug coverage on the Medicare Part B for your transplant medication. Our center is Medicare approved.
Part of a transplant evaluation is a psychosocial assessment by a licensed social worker. This will be updated every year while you're on the wait list. Once transplanted, patients are scheduled with the social worker for routine assessments to check in on adjustment to responsibilities after the procedure. The psychosocial evaluation is a comprehensive assessment where different areas of the patient's life are evaluated. This is important as there are many factors that can have a negative impact on the outcome of a transplant. Through the required social worker evaluation, personal, social, housing, occupational, financial, and environmental support and strengths will be assessed. A kidney transplant comes with benefits, but it also comes with major responsibilities, such as taking daily medications for the rest of the life of the organ. After a transplant, patients have significant restrictions, leaving them in a position of needing help during the period of recovery, or longer in some cases. Poor social support will have a negative impact on outcomes after the transplant. For this reason, the transplant social worker is required to assess a patient's plan of support following the transplant. The evaluation requires patients to identify who would provide care to them at time of surgery and recovery. Please review the caregiver requirements and responsibilities to make sure you designate persons who are able to provide you the care you would need. Other factors that can negatively impact outcomes of a transplant include mental health issues not under control, certain personality traits and disorders, and self-destructive behaviors such as alcohol, substance, and tobacco use. For this reason, the psychosocial evaluation includes assessing your mental health history as well as substance, tobacco, or alcohol use, and how it may impact the success or failure of a transplant. Coping abilities and strategies also play a significant role in having success after a transplant. As there are challenges and adjustments that come with being transplanted, a patient's ability to deal with these challenges, adjustments, and potential complications contributes to outcomes after this type of treatment. A patient's ability to follow the plan of care after a transplant is of maximum importance. This ability is called compliance. History of poor compliance with medical and mental health treatment is a contributing factor to negative outcomes after a transplant. Non-compliance can be either intentional or non-intentional. An example of intentional non-compliance with taking daily medications is not having health insurance and financial resources to obtain necessary prescriptions. The financial coordinator from the Transplant Center will review the benefits of your current insurance plan with you and provide education on estimated out-of-pocket expenses to anticipate after the transplant. All of these elements are important to evaluate before a transplant, as each factor will positively or negatively affect a patient afterward. Any psychosocial concerns will be discussed with the selection committee to determine if the patient is an acceptable candidate for transplant.
Once you've been approved by our selection committee, a final insurance approval is required prior to placing you on the wait list. This approval can take up to 30 days. Once the approval is obtained, you will be listed on the United Network for Organ Sharing, or also referred to as UNOS, UNOS. You will be notified within 10 days of listing. You have the right to refuse a transplant at any time. If you have any questions regarding the UNOS process, you can always contact them at 888-894-6361 or visit their website at www.unos.org. Once you are listed on the UNOS waitlist, it is important that you notify our center of if you have any changes in your health, have heart problems, blood transfusions, any recent hospitalizations, active infections, or changes to your health insurance or your designated caregivers. You will be required to repeat testing and evaluation periodically to ensure you are still a good candidate for transplant. You will need to have your blood drawn at least once a month to test you against any kidneys being offered to you. If you are on dialysis, your dialysis center will send a sample of your blood to us. If you're not on dialysis, we will need to schedule an appointment for you to come and see us for a blood draw. If we don't have any current blood samples for you, you could miss a kidney offer. Make sure that our center has updated contact numbers and that we can always get in contact with you. If we cannot contact you in a timely manner, you may be offered a kidney and you may miss out on it. The average time a patient waits on the waiting list varies from state to state and center to center. The average waiting time here in Texas is about 5 to 6 years. Wait time begins the day of first dialysis. And this goes back to help those patients that have been on dialysis longer to have a better chance of being transplanted sooner. Patients with blood type B is more uncommon, which means that those patients with that blood type will have to wait a little bit longer for transplant. However, patients with blood type B can receive kidneys from donors with blood type A if they meet certain criteria. If this applies to you, you'll be asked to give a separate consent that allows you to accept those types of kidneys. Patients placed on the UNOS waitlist are placed according to three main factors. 1, blood type, number 2, tissue type, and number 3, panel reactive antibody, which tells us how active your immune system is. Deceased donors are registered with UNOS by the local organ bank. Deceased donor organs generally come from people who have been declared brain dead from falls, strokes, or accidents. The donor organ is affected by the donor's age, health history, cause of death, and any event that happened when removing the organ at the time that it comes out of the body. The UNOS computer database matches recipients with deceased donors based on blood type and genetic information. Patients who are hard to match due to their antibodies or blood type will have additional priority. Patients have the right to be listed at multiple transplant centers. However, it may not be financially plausible for everyone. So we encourage you to discuss your wishes with the transplant program.
Many patients may wonder, who can be a living donor? Does my donor have to be the same blood type? Can you live a normal life with one kidney? Well, I would like to address some of these questions over the next few minutes. Living donation is the best option for kidney transplant. Some of the benefits of having a living donor transplant includes decreased waiting time, better genetic match, less chance of rejection, and longer life of the kidney. Living donor transplants are preferred because kidneys from a living donor last twice as long as a kidney from a deceased donor. Living donor kidneys usually function immediately after surgery. You can plan for a living donor transplant, whereas a deceased donor transplant can occur at any time. A living donor does not have to be related to you. They do not have to be the same blood type. Their blood type needs to be compatible with your blood type. However, if your living donor is not compatible, kidney pair donation may be an option. In kidney pair donation, or KPD, we will find another living donor that matches you and find another recipient that your living donor matches and swap donors. Our age criteria for living donors is 21 to 65. Anyone over the age of 65 is evaluated on a case-by-case basis. There are a few contraindications for living donation, which include being diabetic, obesity, which means having a BMI greater than 35, having an infection that can be easily transmitted to the recipient, such as hepatitis or HIV. Living donors will have extensive testing that includes blood work, imaging studies such as a chest X-ray, abdominal ultrasound, and CT scan. They will also be evaluated by the social worker, living donor independent advocate, dietitian, pharmacist, nephrologist, and surgeon. The living donor coordinator will present their case to the selection committee to determine if the donor is a suitable candidate for donation. If approved, the living donor transplant will be scheduled. The living donor will undergo laparoscopic hand-assisted nephrectomy, which means 4 incisions on the abdomen. With this technique, there is less pain, less scarring, and faster recovery. The expected hospital stay is between 2 to 3 days. If the donor is not a candidate for laparoscopic surgery, an open nephrectomy may be done, which involves making a larger incision. The expected hospital stay may be 2 to 5 days, and the surgery takes 2 to 4 hours. A person can live a normal life with one kidney. Living donors do not have to take special medications. Living donors should maintain healthy habits, such as having a healthy diet, exercising regularly, and staying well hydrated. A few tips to help you talk to someone about donation is to share your story. If you are comfortable, share as many facts as you can about your kidney disease. You can also use social media, but be cautious when sharing personal information. Our staff can help provide additional guidance. If you know someone who is interested in donation, ask them to contact the living donor coordinator.
The transplant kidney will be placed in the right or left lower quadrant of the abdomen. Native kidneys are generally not removed prior to surgery. The surgery can take between 2 and 4 hours. After surgery, you will be transferred to the ICU, where you will stay for 24 to 48 hours. You will then be transferred to a private room on the renal floor for the remainder of your hospital stay. The expected hospital stay is between 5 and 7 days. Visitors may be limited Your bedside nurse will inform you of current visitor policies. No plants or flowers will be allowed in your room due to the risk of infection. During your hospital stay, you will receive education on caring for your new kidney from the transplant coordinator, social worker, dietitian, and pharmacist. Some complications that can occur after a transplant include delayed graft function. This occurs when the transplant kidney does not work as quickly, and some patients may require dialysis for a short period of time. Infection. The medications given to prevent organ rejection suppress your immune system, which places you at a higher risk of infection. Rejection. This can occur when your immune system recognizes the transplant kidney as foreign and tries to reject and destroy it. Diabetes. It is possible to become diabetic after transplantation due to the medications required for transplant. Once you are discharged from the hospital, you will have certain lifestyle limitations for a period of time, such as driving restrictions, travel restrictions, and needing to take time off of work. There may also be restrictions with pets. You will require close follow-up at the transplant center and may be required to come to the clinic daily for up to 2 weeks after discharge. It is important that we check your medication drug levels, vital signs, and urine output.
After your transplant, you will be required to take medications to prevent organ rejection. There are 3 anti-rejection medications that you will need to take for the rest of your life or for as long as your transplant kidney is functioning. Each medication works in a different part of the immune system. These medications can be expensive and can have side effects. You will also be prescribed medications to prevent bacterial infections, viral infections, and fungal infections. Our staff will always be available to help you after your transplant. We have a coordinator on call 24 hours a day, 7 days a week. Patient responsibilities after transplant include taking all your medications as prescribed, keeping up with all your appointments, report any concerns as soon as possible, follow up with your nephrologist, and complete your annual evaluation at the transplant center. We are required to submit data to UNOS at periodic intervals indicating how our transplant recipients and their kidneys are doing. The results of this data can be found at www.srtr.org. There are reports available to inform the general public of our transplant outcomes. We are here to help guide you in making the best decisions for you. We look forward to being part of your transplant journey.